how do you think that lack of awareness contributes to stigmatization? Do you think they're correlated and like codependent on each other?
It does to a great extent because although in our country now mental health has advanced over the last few years, and like you've also seen the government making a lot of investment, but at the same time, like you mentioned also, I think education plays an important part from a very young age if that is added into the syllabus through children for children's teachings, also systematic desensitization with respect to parents. So I think one, adding it into the curriculum, making it a part of the process even in the school systems as much as they can, right? Although there are counselors available, but if you see the ratio between children and counselors is too less. There may be one or two counselors available in schools, but a lot of children. So it's also very difficult for counselors to maintain that flow where you at least need to revisit clients, you need to revisit children's issues, but because of lack of time and resources, they can just meet them once in a while. So it becomes more like guidance rather than counseling or therapy, you know.
Yeah,
So
yeah,
therefore,
Yeah.
at a very young age, in the form of one curriculum, providing good services and investment by hiring good counselors and a larger number of counselors in school and institutions as well. And gradually that will destigmatize the entire process. Now, this is at such a level. Now, with your earlier question, now
yeah,
what holds stigma? Now, if you would see people who are privileged can afford therapy, who come in for therapy, even with the same group, there are challenges like some of them don't share a lot with the family that they are going
Yeah.
through the process. So they may hide the process and come. But people who are dependent on their family for financing the process may go through a different challenge, and this pressure of getting the problem resolved very quickly, doing it as soon as possible. So there's no what do you say, freedom with the process as well.
yeah, yeah,
Okay.
Yeah.
So there, now when you talk about stigma too, now let's say what could hold stigma. People still think that mental health services are given to people who are going through severe mental health conditions. Not that mental receiving these services for severe mental health conditions are wrong, but people do come in for basic counseling. People who are going through daily issues like relationship issues, career issues, it could be basic distress and anxiety. And people immediately get labeled as they really have some problem going on with them. It's like almost a disability to a great
Yeah.
extent. Now, in some cases, yes, there is a huge gap between the population, like I said, coming from uninformal urban settlements. There, people still resort to going to traditional counselors like our pundits and similar, like or taking a religious turn out there. Okay, because they
Yeah.
think if you do that, one, it'll happen probably in secrecy, and second, this is one resource. Something else other than that is just, something that everybody around you will come to know. Now, what we used to do is we used to work in places like Dharavi, slums of Kalwa, slums of Kandivali. And if you
Yeah.
see that there are some parents who are really supportive of this entire process. And there, of course, we are not going to screen just children who are going through mental health issues. We are also looking at children who can benefit from the process, like developmental issues, educational challenges, and that is where also counselors come in. But a
yeah,
huge amount of population, major of our work went into getting the parents in, helping them understand what the process is, and post that were they able to send their children. And again, that's a different challenge of how you counsel them.
yeah,
So again, it's lack of awareness, understanding what goes behind the process of mental health services. People worry that every counselor is going to give them medications. That's not the case, right? You can opt for either approaches. So these are some of the challenges still that are being faced both with the population who are poor as well as middle class and the upper class population. Just
Yeah,
very
that's
basic.
thank
So
you
do
so
you
much for that insight.
so do you think like they go through the process like differently, like from the other socioeconomic backgrounds? Like
Now it depends. It depends at what level are we doing it. So let's say if the earlier projects that we used to work in, where we used to go to these uninformal urban settlements, it was at two levels. One was at a precautionary level, where we used to have a lot of workshops, um, train people within the community so that they can go and speak to people and have them understand what the process is. So this is a lot of awareness work that we do, which is very important. And there is a second level where we counselors would provide these individual services, whether it was family therapy, couple therapy, individual therapy to both children as well as their families.
yeah,
Okay,
Yeah,
so this is for this population. And at a larger scale, see, still organizations, that is
yeah,
where if we aim and do workshops. Now you see a lot of corporates have clinical psychologists on board, and they hire a group of counselors, and they keep sending their employees to these counselors. So this is at a organizational level where different groups are created and they keep sending employees as well. So one is, like I said, awareness. One is at an individual basis and educational level, organizational level. So these are different areas how we could engage with, and like you said, at a precautionary level, still a lot of awareness is needed.
yeah,
Okay. Like I said, what goes behind counseling, types of counseling, who are these professionals? People don't know who they are in the very first place. They assume that we are doctors. We are not doctors. We are just counselors. We are
yeah,
psychologists. So the basic distinction is what people are still not aware about. And this comes from people from all strata of life. There's no
yeah,
distinction there.
yeah.
yeah,
Yeah. So I think earlier you addressed the extremity of the problem. Now I think we've all like noticed that like when it comes to talking about mental illnesses like depression, anxiety especially, there's this preconceived societal image that's cultivated in our heads of how it stereotypically appears. Like like
Mm.
it's I think someone that is associated to having suffered or endured like depression or anxiety will be like associated with like crying, being like very always crying or something like that. So I think
Mhm.
can you talk about like the effect of masking these symptoms on an individual because of stigma, and also can you please enlighten us regarding the early signs of mental health, the early signs of mental health, sicknesses or subtle signs that are often overlooked, and what impact does that oversight and have an early diagnosis? Perfect.
Right. So you see now two questions that you're talking about is what is the impact if the
Yeah,
individual holds in all these feelings? And second is early signs of mental health. Now to answer the first question, now you see let's also look at it now early signs of mental health issues. One is at a diagnostic level, okay, like a disorder level. And the other, now mental health issues, like we are also looking at a non-diagnostic level too, right? Which is basic emotional challenges, going through certain life changes, not knowing how to handle isolation. All of these reasons are why people also reach out and come in for therapy. Now, if you're looking at early symptoms, within that too, we'll have to divide. What are we looking for? Right? Now, especially, let's say at an individual level, okay? Let's say if a person feels like they are unable to talk, reach out to people, fear of judgment, feeling too anxious, feeling too low. Let's say sometimes people observe there are a lot of people who are functionally great. If you look at them, you'll not think there is any problem going on. They can manage themselves pretty well, but the
yeah,
challenge is pretty internal. They are not being the best version of themselves. Okay. Now, how do we differentiate that? Maybe the external sources may not be able to view it. At an individual level, you can reach out to counselors when you feel there is extreme stuckness. You're feeling too low. Okay, let's say you're not able to get answers from people, you're not able to reach out, you're not able to talk, you're not getting good guidance from, let's say, your immediate family members. This is at a very basic level. Okay, such exploration can also be done through mental health services using short term therapies, just to figure out what is not okay with my life and what is it that I would like to work on. Whether you want to continue the process or no, post that, that's up to you. Okay. Now, at a diagnostic level, what are some of the things that you can look for? Let's say a person stays aloof from relationships, is not able to engage, poor performance in workspace, poor performance at school. Okay. Let's say sudden behavior changes within the person, whether it is behaviorally, performance wise, however you look at it. Sometimes you just observe a person is not behaving their genuine selves. Now, especially with depression, one of the basic things that we look for is sudden loss of pleasure. Pleasure, even in things that people themselves used to enjoy before. Now, that is one area that we want to reflect on. Something that you generally enjoy and would do on a regular basis, but suddenly out of the blue or through these through this process, you're not able to enjoy the same things. That is something you can, pay attention to. Okay. Sleep issues. Let's say issue with appetite. Okay. These are some of the immediate cues that you can look for mood changes. Okay. Now, let's say poor self-esteem and lack of confidence coming in the way so much. Now you also need to pay attention that all of these symptoms that we are talking about is felt by most of us at a basic level. It's not something that we can't handle. Okay. So it doesn't mean that everybody going through these problems come in for therapy. But if
Yeah.
it causes significant issue and it is happening for a continuous amount of time and you're not able to do anything about it, that is when at an individual level you actually come and seek out and come in for therapy.
So where can you
Okay.
draw that line? So like between something that's just like, like trivial stress or like something that's actually a serious mental health condition.
See, now if you're talking about mental, again, diagnostic, now let me tell you how people do that. There's something called as the DSM, okay, which is called as the
Yeah.
Diagnostic Statistical Manual. Okay, we are at number 5 right now.
Yeah.
Okay, so psychologists use that as a general criteria, but still majority of the people do not fit in each and every criteria.
Hmm.
So we can't diagnose them at that very level. See,
Yeah.
which is why I said that it depends on the issue that you're talking about, because there are varied issues. Okay. When you talk about mood, it comes under a different category. Anxiety comes under a different category. So at an individual level, that is what I'm saying. If you feel that you cannot handle it beyond a specific amount of time, it's just not getting better. Now I'll give you an example. There's something called as major depressive episode.
Hmm.
Now, this episode lasts for 2 weeks.
Yeah.
Okay. Now, that comes under a diagnostic criteria. Okay. Now, sometimes people start feeling better after that period. Okay. So, the depressive symptoms last for
Yeah.
2 weeks itself. Okay. But not necessarily for everyone, it will be 2 weeks.
Yeah.
Sometimes people even realize that this has happened to them after they've experienced that entire episode.
Yeah.
Okay. So now like exactly as an individual level, or if you're observing someone, if this is being consistent over a period of time, let's say weeks or months, depends from person to person and the situation at play. Okay. See, the question that you're framing right now is very general. Okay. So I can't answer as to what is that strict criteria or that cutoff, when can a person reach out, right?
Yeah.
So some people come in for an immediate issue has come up and it's causing them a lot of distress. They just do not have anyone to talk to. That is when also they reach out to counselors. So you may have to differentiate a clinical issue versus a general counseling issue as well.
Yeah,
Yeah.
Okay,
Okay.
absolutely.
so you'll have to do that. Yeah.
So do you think like especially men, so if they talk about like their depression and their anxiety, they like come out as being and is seen as like being weak. So what do you think of like the stigma around
Yeah,
especially men?
Okay. So now, for men, surprisingly, there are a lot of men reaching out for therapy. Okay. They are not, of course, sharing a lot with the family, but even within therapy, if you see some of their goals, they come from a space where they have to be strong.
Yeah.
Okay. They have to be strong, they have to be the provider. And therefore, they are unable to express that this is the kind of support they require from an external source.
Yeah.
So, when you talk about that stigma, absolutely there is, but we are seeing an increase in the number of men reaching out and coming in for therapy. So, that barrier is an interesting thing that they have crossed, that they are reaching out, but they are still concerned of how they would be perceived. Okay.
Okay.
So this is something that I'm seeing, but there is a huge amount of increase in men reaching out for therapy.
Okay.
yeah, definitely.
So, how would you, what are some of the strategies that these people could possibly use to try and prevent some of these issues or try and, fight the stigma up against it?
Hmm.
Okay. So like we spoke about, these strategies are at an awareness level. You have to reach out to organizations, uh, educate parents in the school systems, include, some schools have begun. Now, see, now what schools are doing is they've started teaching about psychology, let's say from grade 9 or grade 10. That has
Yeah.
slightly begun. But at a very younger age, that is something that you want to at least make the children aware that there are something called as psychologists. What do people do? What do
Hmm.
they talk about? Some of these,
Yeah,
pointers need to be added. So one is, like I said, similar question at an educational level. Workshops are an important part of this entire
yeah.
process, reaching out to the larger population. Okay.
Hmm.
And as well as at an organizational level, like we said, a lot of organizations right now in this very day, now what happens is we create a group of counselors and we provide these different workshops, whether it is with the cops, okay, with organizations like corporates, okay, in hospitals, with the BMC, at all levels, all of these things are taking place. So awarenesses through workshops
Yeah,
and increasing funding as much as you can through the process, because nothing can happen without money.
that's very good.
Yeah.
So
Yeah.
therefore, NGOC, because now, like we spoke about, the government did, if you've heard about this, they gave a lot of a huge sum of money to Nimhans around that period of COVID. Nimhans is a hospital which is in Bangalore, and they do a lot of research and provide wonderful services to individuals there at a very minimal cost. They provide these services. So the
Yeah.
government did give a huge sum to that hospital. Now that's also a good thing, but at the same time, a similar amount of funding, if it goes at an educational level, investing in hiring counselors, even in government schools and similar areas, is something that is very beneficial. So, education plays an important role in stigma. That's how we've reached at least till here.
Yeah.
Yeah,
Yeah,
definitely.
so
Yeah.
yeah, so Miss, at this lower level, since what you're saying, all this is being done, how effective has that been?
It's been pretty effective, but we still need support because, see, again, I'll tell you, when we worked in the NGO, we were three
Yeah.
counselors. Three counselors, not in each area, one counselor per area.
Oh, yeah.
And we have around 500 to 600 children that we enroll. Now imagine seeing these people every day. We can't even see them twice in a month,
Yeah.
right? So what happens is there is again this gap between the amount of counselors and psychologists and psychiatrists that exist, and our population is too huge, right?
Yeah.
Now, there was a period in time where when people used to go and do MBBS, psychiatry was seen as a very useless, profession. People with low marks or even not getting seats would only take those, profession. That is what I heard from certain doctors. Okay. And now gradually there, because of awareness and interest, more and more people opt for psychiatry. Okay. So we want more people to take up these jobs, create jobs, because, a lot of people are also scared of taking psychology in India because they are like, there are no jobs available.
Yeah,
So what a
exactly.
lot
Yeah.
of people do, they go abroad,
Yeah.
right? But you have to also create these jobs. That fear that you're not going to get enough job, or you won't get paid. But and that is also one issue, that budding psychologists don't, because see, we do not have a body for licensing other than something called as RCI, which only gives licensing to clinical psychologists. Now, what about regular counselors, psychotherapists, special educators? What about them, and how do we take care of licensing in that areas? Which is why there are also people who are not well trained and they are providing services. And
Yeah.
therefore what happens is that one bad experience with a counselor, already there's so much of stigma. One bad
Yeah,
experience will stop
yeah.
you
Then they
from
just don't
going to
wanna.
another counselor.
Then they just abandon
Yes.
like
Yeah.
having help.
Then they.
Yeah,
Yes. So a lot of people do not know. Like when we were studying too, we were trying to figure it out while we were studying. What is the licensing? What's going to happen? What about people who don't do clinical? And now they are bringing in so many changes within the system. So we are still stuck. There is some transition period going on. So earlier, what would happen? You do your masters, then you do your MPhil. You do an MPhil from a college that is recognized as RCI, and then you get your licensing. But now they've scrapped MPhil. So now I do
Oh.
not know very clearly what is it, because there are different programs that are coming up,
yeah,
but they are still not very clear. So there is all of
Okay.
these things. So even professionals need to be supported properly.
yeah,
Yeah.
Yeah.
definitely.
And the amount of people who are existing as professionals and creating a system out there. So there are a lot of people who are trying to do that, to create a proper governing body for psychology, but they are still not very successful. They are trying to do it. Like even Nimhans is trying to do that. And surprisingly, Nimhans is not a part of RCI,
Hmm.
and but it's one of the best institutes in India. So this is also another gap.
Okay.
Yeah, definitely.
Does that
So,
Uh,
answer your question, Krish? Or
no,
yeah,
yeah,
sorry.
completely, I think.
Yeah, that does answer the question. Yeah.
Okay.
uh,
So basically, when it comes to mental health, I think we all talked about how people feel like very compelled to be silent about it, especially men, because of like the perception of like masculinity being attached with like imperviousness or like like the lack of vulnerability to we don't man up and all of that. So I think when we're talking about this silence, how do we refer to like mental health conditions being misunderstood, and how do we talk like what effect does that have because of the perception of stigma? What effect does that have on social isolation, and like what effect does that have on like people being silent about it, people masking their mental health issues,
yeah, I
and
think like
how does
most
that,
men
yeah.
just tend to
Mhm.
like deal with it by themselves and like find different coping mechanisms instead of
Yeah,
like actually
yeah,
talking about it. So then like do you think that leads to social isolation or
yeah, and
It
how do
does.
like
It
yeah,
does to a great.
yeah,
See, it does to a great extent because, again, although a lot of men are coming in, they are coming in after a huge amount of time, meaning they realize that they needed therapy 10, 15 years ago, but they didn't know what to do about it. They struggled within themselves for a huge amount of time. And
yeah.
then finally, either because it was too unbearable, or somebody else comes in and encourages them to reach out and specifically gives them a number, then they call that person and try and go in for therapy. But it's a huge process to even sit, reach out, look for therapists. That's not the first immediate, decision made by men.
Yeah, the
A lot
response.
of these people take a lot of time, and even while they are going in, coming in. I have a client who has come in now for 3 years continuously, religiously, very systematically, but still there is no support from the family, where they think that it is a waste of money. They think he is not doing better because they are comparing it to their standards. But
Yeah.
looking at his condition, he knows where he was, he knows what sort of improvement he's looking for. So sometimes that also is a question, as per whose goals am I improving? And
Yeah.
that is one thing that we also help clients understand through the process, which is, how do you identify these goals? How do you separate them from others' goals that they have from you? Okay, and not to feel pressured to do it quickly or things like that, because these things take time. Yeah, and
Yeah.
therefore that guidance is very, very important for both men, women, whoever come in for therapy. But yes, I would agree that for men, it's not the first thing that pops up in their
Yeah,
mind. For women,
exactly.
it's much more easy. I'll go in for therapy. For men, even after a lot of encouragement, it's then that they
Yeah,
come in and reach out for
it's really
therapy.
sad. Yeah.
Yeah,
Yes.
So
that's
I want to understand, like, how exactly do friends and family of like these people, especially men, as you said, like, how do they help support someone who is struggling with like mental health and challenges of stigma in society?
Yeah. So, see, other than providing individual support, okay, sometimes some of these, let's say, spouses, friends, or family, some of them are privileged enough to have support from all of them, and some who don't, even if they get support from one area, what they choose to do is, sometimes they don't choose to tell people that they are going in for therapy, first and foremost. Whether men or women, they don't tell a huge number. They speak to
yeah.
one person whom they trust, especially, and at least having that space where they can go back and forth and have a dialogue is what helps. Because they are aware, realistically speaking, everybody may not support the idea of you coming in for therapy and
Mhm.
the kind of changes that you want to make. So, one is, let's accept that this person has that point of view. But it shouldn't be your task to convince them. It is your task to help them understand. If they do, great. If they don't, you just want to keep it aside, because otherwise it will all become about the society wanting to accept you. Yes, that is a big, big thing that we want to achieve, that you want people to not have stigma about mental health. But if you get fixated on the fact that I'm not getting support, okay, it creates sometimes a problem for the person. So you want to be mindful, but understand who are the people who are supportive.
Yeah.
Those people you can either have a dialogue, they can just encourage you, you can share the process with them because you need that space. And if there's someone who understands your point of view and when required can support you, let's say whether it is to talk to family or things like that, that is sufficient. So at least one person is also enough in today's time to, at least from your personal life, not necessarily just work and things like that, but people at work also support, people at your schools can support. So even that one person, let it be your teacher, your boss, your friend, your one parent, is also enough to begin the entire process. Yeah.
So,
Yeah.
but
But
if this, sorry, I was just gonna ask you, like, if those people that they don't get like that support from anyone, and like there's a lot of like word around that it considers you, then makes you weak, or does it discourage those
I
people
also
from
think like a lot
seeking
of
help?
people like for our age, especially like teenagers, if someone talks about their mental health, they people think they're doing it for attention or they just want
Yeah.
like people to talk about them. So that's why they're like making things up. So
Yeah, so does that stigma like discourage them from seeking help?
it does. See, it does. Like especially when Krishiv mentioned about children. Now, children are dependent on their parents,
Hmm.
right?
yeah.
And then when they talk about these things, sometimes you just want people to just have an open mind, one,
Hmm.
and just to have that first level dialogue. Does it discourage?
Yeah.
Absolutely. Now, it discourages even more, let's say, if it is a child who wants parents' support to go and talk to the counselor, let's say for financial reasons or just to be able to reach out to a counselor. So, if you're dependent at that level, yes, it discourages. Now, an adult who is independent, let's say to them too, it is discouraging, but at least they have financial independence, so they can at least have one call with a
Yeah.
therapist to
Yeah.
understand, is this something that I should be working on? Just that one dialogue. And actually, even for children, let's say if you're not able to speak to your parents, that is when school counselors and some free services are available. Calls are available, free calls that you can make. There's this service called as iCall, there is Good Samaritan, there's this Vandrila Foundation. All of these organizations, they provide free counseling services on call, right?
Yeah.
So if nothing works out, at least reaching out to professionals through these mediums to understand how people can support you and what are
Yeah.
different ways of receiving.
Yeah.
Yeah.
Yeah. I think
So
how
these
can,
ways are
yeah,
different.
sorry. Sorry, sorry. Please
Go
go.
on, go on. No, 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 no. Go on, go on. Go
So
on.
I think you mentioned how, like, I think Kisha was talking about how when teenagers, like, it's often like associated with like attention seeking, and there are often these like myths regarding it. So, and I think because of that, people like get into patterns of masking it. So how can someone consciously unlearn or like rewire masking behaviors in environments that like still demand conformity, like teenagers? And is this masking a form of self-protection, or does it ultimately create more harm than good?
Which action are you talking about exactly? Which
I
is?
think like coming out, talking about their depression, their anxiety.
Yeah. Or like overcompensation.
Mhm.
When someone is sad, they try to like overcompensate with it by acting like with being loud or like, smiling more, being more funny, or like basically masking their true
Mhm.
selves. Yeah.
See, exactly. See, defense mechanisms or ego defenses, however you'd like to call it, is something that we learn from childhood.
Hmm.
Okay, if there is no proper medium to express. See, as now talking about it very from a very basic perspective, when children are growing up, they just need three things from parents and the society around them. One is to recognize their feelings, validate their feelings, and educate them about what they are experiencing. Now, sometimes many people don't get these things, because of which mood challenges, anxiety, stress, because children do not know what to do with some of these feelings. Now, if they are
Hmm.
shunned and are not given a space to express those feelings, that turns into ego defenses, which is one thing
Yeah.
what you mentioned, Sana, like acting in, keeping everything in
Yeah.
and not expressing what you're feeling, your unpleasant feelings, and masking them with by acting that you're okay,
Yeah.
right? That is acting in. Then another ego defense is acting out. So what do
Yeah.
you do
Yeah.
is, you feel something and you express it and it comes across through another area. There's something bothering you at home, but through different behavioral issues, let's say it manifests itself in your school, right?
Hmm.
That could be acting out. And then comes something called as projection,
Hmm.
okay,
Yeah.
where project your feelings onto other people, assuming that they are going through something similar,
Yeah.
Yeah.
right?
Yeah.
Yeah.
Definitely.
So
Exactly.
that these are different ego defenses that can come up. So this is a consequence of not getting a space to emotionally regulate yourself in healthy manners, either through validation, having a dialogue, understanding what you're going through, and educating yourself whether this is okay or not, what I'm experiencing. For that, you want to have dialogues. Now, if you do
Yeah.
not get this growing up, these are the challenges that come up. So you're absolutely right. These ego defenses come up. And then what happens is you get used to these ego defenses.
Yeah.
So
Yeah.
even as adults, you're continuing to use them. And that
Yeah.
is when you start facing issues.